According to the Heart and Stroke Association of Canada, heart disease is the leading cause of premature death for women in Canada. Yet many still view it as a men's health issue. Naturopathic Dr. Joyce Johnson joins us to discuss simple lifestyle choices that can help decrease the risk of developing heart disease and protect our loved ones. Good morning. Thanks for joining us.
Good morning. Thanks for having me.
Yeah, many women would fall into a category, a risk category. Could you break it down for us?
Absolutely. Well, I think a lot of people aren't aware that heart disease is really the number one killer for women in Canada. So it's something that we always thought would be a man's disease, and not a lot of emphasis has been placed on as much research going towards women and how heart disease can really impact us. But we do know that the risk for heart disease drastically increases for women, especially after menopause, when estrogen is no longer present in high amounts. And we know that estrogen is heart protective. So it's essential that women pay more attention to their heart health.
Yeah, of course, family history is one risk factor, but there are many other risk factors
Yes.
that we can do something about.
Absolutely. Like, you can't control gender, you can't control your age, but you can control smoking, you can control having high blood pressure and managing it. You can control high cholesterol and diabetes and physical inactivity and obesity.
So what's the best way of managing cholesterol?
Okay, so the first thing that you want to think about when it comes to managing any type of risk factor for cardiovascular disease that you can control is your diet. So nutrition plays a big role. Managing cholesterol and triglyceride levels, which is the fat in your blood, you can do that by incorporating more fiber in your diet. Fiber is essential for helping to lower these two, so cholesterol and triglycerides. But we also need to focus on fats. So fats such as omega-3 that you can find like in cold water fish, for example. So the recommendation is this: you eat twice a week. If you can't, because it can be difficult to get that in twice a week, is in a supplement form. Also, healthy fats, you're looking at things like olive oil, extra virgin olive oil, you're getting in some avocado. So making sure that you're not forgetting that there are good fats out there, good fats that could be beneficial for your heart.
Yeah. Now, of course, blood pressure, extremely important. What's the best way of controlling that?
Well, a lot of things can help to maintain healthy blood pressure, but when we're talking about diet can be important. So nutrients like fiber and potassium in your diet can be beneficial at helping to manage. So focus on some foods that are high potassium, high fiber. An example would be bananas. We have some spinach. We even found that dark chocolate, only about 2 squares per day, seem to help promote the dilation of blood vessels. So these are some foods that are important. Also, for high blood pressure, you can look after your coenzyme Q10 levels. So that is an antioxidant that has a strong affinity for your heart muscle. And sometimes some drug therapies, beta blockers, or statin drugs that you might be taking lower coenzyme Q10 levels in your body. So it's important that you work with your prescribing physician or your pharmacist or your naturopathic doctor in determining what supplement is necessary for you.
Yeah, and weight management, of course. And what about blood sugar levels?
Yes. Yes, absolutely. Blood sugar levels for sure. So that really is going to have to do with making sure that you're controlling your portion size, that you're eating every 2 to 3 hours, that you're increasing fiber in your diet. The average person gets about 12 grams of fiber per day, and we know that women need at least 25 grams of fiber per day, and men upwards of 35 grams of fiber. So by increasing fiber in your diet, it slows the rate that your body is able to break down food so that glucose is released more gradually, and you don't get, a drastic spike and then a drop. So it's important that we keep that a little bit more steady and maintained. So making sure that you're controlling your blood sugar levels absolutely is key.
Yeah, because it's so important, because particularly with women, the signs are actually deceiving with heart problems and an impending heart attack. So it's so important. I wish we had more time, but we will link all your socials at chch.com for more information on this. Great tips, though. Naturopathic Dr. Joyce Johnson, thanks for joining us this morning.
Thanks for having me.